I landed on my knee and I immediately heard a noise. I couldn't get up on my own. People had to help me to get to a corner. I rushed myself into a hospital and the doctor said everything was fine, but he advised me to go and take an MRI, and that's when I realized it was a third-degree tear, a complete rupture of the ACL. When I was about to head to the operating theatre, I remember there were nurses around me. They actually briefed me what I should be expecting. And I remember as soon as I was entering the operating theatre, one of the nurses told me that I will feel cold. And then I was taken to the operating table, and the team was very friendly. They asked me to announce my name, my age, just to make sure that I was conscious. And I heard music. My first impression when I came into King's was very friendly staff, starting from the point where, you know, at the entrance where you get greeted. Everybody was very friendly. They guided me to the unit where Dr. Shine was based. I had a very positive impression on the first day itself. So before the surgery, I was in this room, and when I consulted Dr. Shine, he obviously saw that I was nervous. I remember he took a piece of paper and he sketched you know, the ligament, and he told me there's no other way for a ligament to grow, and the only way is to do a reconstruction. So a piece had to be taken from my hamstring in order to create the new ACL. So he was quite helpful. At the same time, he was informing me, making me aware in terms of what I'm supposed to go through in the next couple of months.
Patient Kanishka, young, very active lady, lots of sporting activities, was participating in a Spartan race and fell and had a very bad injury, presented to me with a painful knee, unstable. MRI scan showed a complete rupture of the ACL ligament. I suggested surgery. She was a bit apprehensive in the beginning, but decided to go ahead. She has done tremendously well. She's gone back to all her sports and activities, and she's even thinking of going back to the Spartan races again.
I'd like to thank Dr. Shine for taking good care of me, being my doctor. Also the physiotherapy center who helped me with movement therapy. My trainer who helped me to get back into track.